All right, so when was the last time you went to the dentist? Even if you go regularly, you probably have some questions about why certain things are done during your dental appointment. Well, today we're joined by Dr. Malik Johnson, a dentist here in Greensboro, and we're taking your questions. So what we want you to do is get your question to the expert. This is the best person to ask, 336-379-5775. Okay, we're going to just ask some kind of like common questions so that we can kind of get answers to some of the things that we're wondering about. Like number one, how do I prevent cavities and tooth decay? Because nobody wants to be in your chair. No offense.
Yeah, I've learned that nobody wants to be in my chair. But okay, so the biggest thing, right, is brushing, which we all are pretty aware of. Brushing your teeth 2 times a day, right? So you brush in the morning to keep your friends, at night to keep your teeth. Because all day, all that stuff you're eating and stuff, it sticks to your teeth. If you go to bed with that stuff still on your teeth, that's going to lead potentially to some cavities. So first thing you want to do is put that toothbrush to action, right? So brushing your teeth is essential. Flossing is essential too, because what happens is those little bits and pieces of food get stuck in between those teeth. If you're not flossing it out, it'll stay there. Bacteria will come and eat on it too, and start eating away at your tooth as well, and thus decay. Um, and one of the, I guess, toughest things about it is you get adult teeth starting at age 6. And obviously, at 6 years old, no one is really that keen on taking care of yourself at all. So I say that to say another important thing is to go ahead and establish a rapport with a dentist or get used to going to the dentist. Because we have those checkups early on. If I'm in your ear early on telling you kind of, what you can do to avoid those cavities, it's only going to be better for you.
Gotcha. Okay. All right. How about this? Can drinking water prevent cavities? We've heard about how we need to like drink water and how it's going to help us, but how does it help us?
Well, drinking water definitely helps. It's going to, one, if we get, technical here, cavities and all those things form in acidic environments. Water is a very neutral thing that's going to, eliminate some of that acidity and some of those things that cause those cavities. One. Two, water is very good for stimulating saliva. Saliva has a lot of things like immunoglobulins and different good things in it that help to replenish the teeth, rinse away those cavities and all those nasty things as well. And also, the more water you're drinking, hopefully the less soda and juice you're drinking, which is also only going to enable you to fight those cavities.
Okay, now I've heard this before, and you tell me why this works. People said, like after you have a cup of coffee or after you have a soda, you should always like have a drink of water or swish with water before you brush your teeth. Why is that?
That's a great question, Tanya. You're on fire today. That is because, so if you have that coffee or that soda and it's in your mouth, right? And let's say you brush around with it. What you actually do is you kind of spread and smear that sugar and whatever it is that you've been drinking kind of all over the place, right? And yes, you have toothpaste, which, they'll kind of be trying to fight. But if you take that coffee, take that soda, take that tea, rinse it out first, kind of get it out of there, and then brush, instead of smearing around that sugar, all you're doing is, giving everybody a good toothpaste bath.
Okay, gotcha. All right. So then the next question would be, because a lot of people have very specific things about what they use. What's the best type of toothbrush to use?
Best type of toothbrush is going to be soft, number one. And a lot of so my thing with electric is you can do some of the same things manually, but you got to know what you're doing. So electric is going to eliminate you having to do a whole lot of crazy motions because it's going to rotate, it's going to do all those things it does. So a soft electric toothbrush would definitely be recommended. And a lot of people think, oh, I need to spend, all this money if I want an electric toothbrush. But actually, I've noticed that Walmart, even Amazon, they have electric toothbrushes that are like 15, $20 sometimes. So definitely get an electric toothbrush and make sure it's soft, not hard, not medium, but soft.
Okay, so if you're using an electric toothbrush, then you should not be doing any kind of movement of brushing. Is that right?
You still, you still guide the brush around and you still can go up and down and stuff like that. But most of those electric toothbrushes, move at the head of the toothbrush. They have different motions that are proven to remove plaque and remove bacteria um, in a very favorable way.
Okay, but we don't want to be scrubbing our teeth with the electric toothbrush. We really don't want to be scrubbing our teeth with the other toothbrush either.
You got it, Tanya. We want to give teeth massages. Okay. We don't want to scrub because what you might do is you might cause your gums to recede. You might cause your enamel to wear. It might be abrasive. So you want to use a soft toothbrush. You want to be diligent. You want to get all your spots, but you want to think about teeth massages more than power scrubbing.
Okay, gotcha. All right. Well, we're going to talk about whitening our teeth. We're going to talk about x-rays and why we do them. And we're going to be taking your questions. Again, 336-379-5775. We'll be right back.